says they are preparing for an expected surge of COVID-19 cases, telling Action News tonight that they expect the curve of coronavirus cases to exceed their medical capacity. Action News reporter Christopher Salas joins us now. And Christopher, what are health departments doing to prepare? Because this is what they're fearing, right?
Exactly.
It's that big jump in cases.
We talk about flattening the curve. Well, if they don't flatten it in time, right, they get that big jump. It goes past medical capacity. Basically, what they're going to do is they're going to start putting hospital beds in places they wouldn't normally put them. They expect this surge to happen within the next 2 weeks. And it's very much in line with this study from researchers at the University of Washington. They say that COVID-19 cases in California will peak in mid-April. Actually, April 24th is what they're expecting. Now, what they're saying is that California as a state does have the capacity for hospital beds, but it's a very different projection in Santa Cruz County.
We are anticipating a surge, maybe in waves.
Which means in Santa Cruz County, there may be multiple curves health officials want to flatten, but the initial surge of COVID-19 patients could prove challenging.
Well, I think our surge will exceed the current bed capacity in the county, and we're planning for that.
Now, in response to that expected surge in COVID-19 cases, Santa Cruz County is going to put hospital beds here at the Simpkins Family Swim Center. The county also plans on having more beds at an undisclosed site. Combine that with the mobile hospital, and it could mean up to 180 more hospital beds. Those alternate care sites will not have ICUs or ventilators.
That's where we're really worried, but we are working with our hospital partners to look at ways to increase those capacities within the hospitals themselves.
They also need staff.
We're asking for volunteer physicians, nurses, retired folks with medical skills to come help us.
It's a different story right now in Monterey County. In an email obtained by KSBW, Montage Health CEO Steve Packer says there is a decrease in demand for services, and workers are being asked to reduce hours by 10%. As for when it comes to handling a surge, Community Hospital of the Monterey Peninsula says they are meeting each day to plan. Salinas Valley Memorial Healthcare System says they're having, quote, great success handling COVID-19 patients, and they're confident. Natividad says they're also confident. They have state approval to repurpose other areas of the hospital for more beds, but they do admit it could be challenging if they see a rapid surge. All healthcare systems continue to stress the same message.
The bottom line from our community is we're asking them to stay at home, shelter in place, follow the orders as much as possible, essential services only.
Now, if you would like to see more from this report, I already have an attached link in my article on our website, KSBW.com. And Aaron, just to drive home the point that they feel confident in Monterey County, I know you spoke with one of the county's leading infectious disease specialists, and he said it seems that they do have enough ventilators.
Dr. Alan Radner said last week that they do believe that they have enough ventilators and they have enough ICU beds to at least handle the surge. He's confident last week, but we're going to have to see what happens in the next couple.
Exactly. At least that's a little reassuring, though.
It is.
Yes.
Thank you, Christopher.